Hello everyone and welcome to Edusurg Small Talk series where we discuss some key topics related to surgical practice. First of all, I would like to thank you all for supporting our YouTube channel and suggesting this topic. So today is a topic based on your suggestion and we are going to discuss anal canal anatomy. So dividing this topic into a few parts because it's a bit tricky to understand. So in this first part, we are just going to discuss some important terms, definitions of those terms, and some landmarks that help you in understanding the anal canal anatomy. These are the terms that usually confuse us in our medical journey. And so here we will try to simplify all these terms and clarify the definitions for you. So as we have seen, and I am sure most of you would have seen this image, that the rectum and the anal canal are divided by what is known as levator ani or the pelvic floor. So this levator ani forms an anorectal ring which we can palpate during the perrectal examination, right? So rectum becomes the anal canal below the levator ani or the puborectalis sling which forms the anorectal ring, and this point is known as anorectal junction. Now this anal canal, that is the entire anal canal which is below the levator ani, is actually the surgical anal canal, right? So there are two major types of anal canals, surgical anal canal and anatomical anal canal. So this commonly seen figure in our textbooks is an oversimplified version where the rectum becomes the surgical anal canal below the levator ani, which is also identified in perrectal examination by the anorectal ring or the puborectalis sling which forms this ring, and this area is known as anorectal junction. So this much is usually clear to everyone, but however, this is an oversimplified version of anal canal anatomy. So let us now see this in a bit of detail to understand the various terms that I am sure many of you would have heard, but which are confusing to most of us in our initial medical and surgical careers. So when we discuss anal canal landmarks, let us try doing this from below upwards. And first of all, we need to know few of the basic layers of the wall of the anal canal for knowing these terms. Now don't get worried if you don't know these muscle layers or even the details of pelvic floor and the sphincters, because I am going to cover that in subsequent videos. However, this is just a brief overview of these structures so that we can understand the anal canal anatomy. So this is the mucosal layer of the rectum which continues below the puborectalis sling as the mucosa of the anal canal, right? The rectum continues below as the anal canal. So now to break the previous image into multiple layers, this is the levator ani. And now you know that the levator ani, the puborectalis part of this forms the anorectal ring by the puborectalis sling, and this is the landmark which divides the rectum and the surgical anal canal, right? The part of the gut above the puborectalis sling is the rectum, whereas the part below is the surgical anal canal. So outside the mucosa is the circular muscle coat, and this circular muscle layer of rectum below the puborectalis sling forms the internal anal sphincter. I would again say that please don't get worried if you don't know these muscular layers, because the muscular anatomy of this part is going to be a separate video. This is just a brief so that I can describe the landmarks of the anal canal. So the circular muscle layer of the large intestine becomes the internal anal sphincter in the surgical anal canal, and the longitudinal coat of the rectum above the levator ani becomes the conjoined longitudinal cord of the anal canal. There are three parts of the external anal sphincter: the deep external anal sphincter, which constitutes some fibers of the levator ani; the superficial external anal sphincter; and the subcutaneous external anal sphincter. Right. So this is a bit of a detailed anatomical overview of the anal canal landmarks, where you can see the levator ani and the puborectalis sling. You can see the internal and external anal sphincters, and between them the conjoined longitudinal cord. Why we are going into details is because this part highlighted by the two circles is a very important part, as this has some applied anatomical importance as well as importance in identifying some of the landmarks that I am going to discuss now. This area between the internal and the external anal sphincter, I will repeat, this area between the internal anal sphincter and the external anal sphincter is palpable and is known as the intersphincteric groove. This is a very important part because if you are aware, intersphincteric resections are now performed, and this is the groove that we need to palpate to identify this plane from the perianal side. The lower end of the intersphincteric groove is where the anal verge begins. So this is the first lower landmark that we need to know. Now, anal verge is a very important landmark for endoscopy, for MRI, as well as for clinicians, because the distance of tumors from the anal verge are measured, right? And the entire plan of management depends on this distance. So, in MRI, the lowermost limit of the external anal sphincter in the parasagittal plane is considered as the anal verge. So some people describe anal verge synonymously with the intersphincteric groove. That is, the intersphincteric groove is the area where the anal verge is. Now, anal verge is also defined as a junction between the anoderm and the anal margin. So below the anal verge is the anal margin, which is now also known as the perianal skin, whereas above the anal verge is the anoderm or the anal mucosa, which we will see in the upcoming slide. So anal verge is the lower limit of the anal canal, and in some books it is described as the part between the intersphincteric groove and the anal margin, whereas essentially anal verge is the intersphincteric groove area, and it joins the anal mucosa with the cutaneous plane of the anal margin, and that is why anal verge is also known as anocutaneous line. We will see this in the next slide. So now when we see the anal canal landmarks, we know that the surgical anal canal begins when the rectum crosses the anorectal ring, which is the anorectal junction, and now the intersphincteric groove is the region which marks the anal verge, which ends where the perianal skin begins. Perianal skin is also known as anal margin. So this is now basically the extent of anal canal, and this is surgical anal canal from anorectal ring or puborectalis sling, which we can palpate in the rectal examination, above to the anal verge below. So what is surgical anal canal? Now we can define surgical anal canal. It is a part of the gastrointestinal tract, or the part where rectum crosses the levator ani, which is known as the anorectal junction, which is formed by the puborectalis sling, which forms the anorectal ring, and it is up to the anal verge. Now what is anal verge? It is also known as anocutaneous line, and we will see these mucosal coverings soon. So anal verge is also known as anocutaneous line, It extends from intersphincteric groove to the anal margin. However, essentially anal verge, anocutaneous line, and intersphincteric groove are nearly all in the distance of 4 to 5 mm. What is anal margin? Anal margin is now the perianal skin, and for tumor purposes, anal margin involves 5 centimeter radius from the anal verge. Now there is another entity which is known as white line of Hilton. Some people use white line of Hilton to be synonymously with intersphincteric groove, and some people use it synonymously with anal verge. This description has been different in different books, but essentially anal verge, anocutaneous line, that is the junction between skin and the anoderm, intersphincteric groove, that is the groove between internal and external sphincter. Both these entities were described by Hilton during his surgical career. He described white line as a line which demarcates the internal and external sphincter and which demarcates the skin and the anoderm. So essentially, both these definitions equate to definition of anal verge. So I would remember these terms synonymously: anal margin as the outside, then anal verge, then intersphincteric groove, and anal verge marking the intersphincteric groove as well as the anocutaneous line. So as I described, it is the junction between external and internal anal sphincter and the junction between skin and anal mucosa. That is anal verge. So as I said, anal verge is also known as anocutaneous line. And now we will use some of the terminology to understand why these structures are named as anocutaneous, mucocutaneous, and so on. So this is the anal canal that we have seen already. I have cut the levator ani part and the rectum part. So you already know the red ring is the puborectalis sling and the bottom line is the anal verge. So now let us see few terminologies synonymously used with anal canal landmarks based on the mucosa. So the first terminology is the part of the skin below the anal verge, which is known as the anal margin, also known as the perianal skin. Now this is an area of the anal canal anatomy which is a bit confusing, but when we see tumors, 5 centimeter radius from anal verge is the anal margin. This is nearly same as the skin and it contains keratinized stratified squamous epithelium with sweat glands, sebaceous glands and hair follicles. Each of these terms are important when you describe the skin of anal margin. And that is why when cancers occur in this area, they can be squamous cell carcinoma, melanoma and many others. They are similar to skin cancers. Now, when we go above, the anal verge contains apocrine sweat glands, but they do not contain hair follicles. And that is why the disease known as hidradenitis suppurativa, it's okay if you don't remember the name, but this disease can arise in anal verge and it is very painful. It arises from these apocrine sweat glands. So the first type of mucosal lining is the cutaneous zone, which is below the anal verge in the anal margin. The second type of lining is at the anal verge where you have apocrine sweat glands but you do not have hair follicles. From anal verge to around 2 centimeters above, this is a rough estimate, you have the dentate line, right? 2 centimeters from anal verge roughly you have the dentate line, also known as pectinate line or the mucocutaneous line or the watershed line, right? We will see dentate line anatomy in the next slide, but to understand the mucosa, Around the level of 2 centimeters from anal verge, you have the anal canal part as highlighted by the green boxes, and this part has the classical anoderm, which is non-keratinized stratified squamous epithelium, and it does not have sweat or sebaceous glands, and it does not have hair follicles. So now if you see, anal verge separates 1 from 3, and that is why it is known as anocutaneous line, right? So anal verge or anocutaneous line, and 2 centimeter area roughly above the anal verge contains the classical anoderm. Above the dentate line, 2 centimeters is the columnar epithelium, which is the colorectal type. And that is why only the anal canal, which is lined by the classical anoderm, is known as the anatomical anal canal. So it is only the lower 2 centimeters of the anal canal which is known as the anatomical anal canal. This is the part of anal canal between dentate line and the anal verge. So now you understand. Based on mucosa, the anal canal lined by classical anoderm is the anatomical anal canal, which lies between dentate line and the anal verge. Now this is one area highlighted by dotted lines that I would like you all to think before I go into it what this area is. I'll take a 2-second pause. So I'm sure some of you would have guessed this area by now. This is one of the most important areas that we need to know in the anal canal when we perform surgeries for ulcerative colitis or familial adenomatous polyposis. So with this hint, I am sure most of you now know this area is the anal transition zone. Now, what is anal transition zone? It is an area or a zone which is between uninterrupted crypt bearing columnar mucosa of the rectum above and uninterrupted squamous epithelium below. Right? I will repeat. Anal transition zone is an area which contains mixed epithelium, and this is a transition from columnar epithelium of the colorectal type above to the stratified squamous epithelium below the anal transition zone, right? This zone is important because it has extensive innervation, especially above the anal valve region. We will come to this in detail. And this area in deeper layers can also have melanin. That is why preservation of this area is important in cases where we are going to do ileal pouch anal anastomosis. So anal transition zone extends usually 4 to 6 mm below to 1 to 1.5 centimeters above the dentate line, right? So this is where anal transition zone is located, and it can have variable type of epithelium such as basal epithelium, columnar epithelium, cuboidal, transitional, as well as squamous epithelium in different layers. That is why it is known as a transition zone, that the mucosa of the columnar type transitions in the anatomical anal canal into stratified squamous epithelium. So in the definition, when you are asked in exam of anal transition zone, the word uninterrupted is very important. So it is a zone between uninterrupted columnar mucosa above and uninterrupted stratified squamous epithelium below, right? And as we have already discussed, the entire yellow part from anal verge to the puborectalis sling is the surgical anal canal. So this is the 5 different types of epithelium in the anal canal. The different terms like anal margin, anal verge, anoderm, anatomical anal canal, dentate line, pectinate line, anal transition zone, and surgical anal canal. All these terms are based on the different types of mucosa as well as different types of landmarks based on the anal canal musculature. So now let us see the dentate line. As we have already seen this part, the dentate line, pectinate line is also known as the mucocutaneous line or the watershed line. This is a very tricky part of anal canal anatomy. So now let us zoom into the dentate line and see how it is formed. So two different structures help in formation of the dentate line. There are these columns which are known as anal columns of Morgagni. These columns extend from puborectalis sling above to the termination below where they form the dentate line. They are essentially pleating of rectum into the muscularis mucosa bundles which end at the level of dentate line, and that is why some people consider anal canal as anatomical anal canal below the dentate line up to the anal verge, right? So anal columns of Morgagni are muscularis mucosae bundles with cuboidal cell stacks, and as you can see there is some space between anal columns of Morgagni. So let us now see what that space contains. Between the anal columns of Morgagni lie the anal cushions, which are cushion-like structures formed due to extensive submucosal venous plexuses. I am sure most of you know that these are the anal cushions which can lead to formation of internal hemorrhoids, right? So between the anal columns of Morgagni are the anal cushions which are formed by submucosal venous plexuses. So these two structures are now clear. Now connecting the lower end of the anal columns of Morgagni are the anal valves. And why are these valves important? Because these valves and the lower ends of anal columns of Morgagni are what form the dentate line, right? Above these anal valves are the pockets which contain the anal crypts or sinuses. So above the anal valves, in the pockets formed by them, are present the anal crypt and sinuses, and the anal glands open into these anal crypts and sinuses, right? What are the anal glands? They are anal glands predominantly in the submucosal layer of the anal canal, which are lined by columnar stratified epithelium with goblet cells, right? These are vestigial glands and not of much significance, and usually they are present only up to the submucosa, but they can also extend up to or beyond the internal anal sphincter, and sometimes they can also reach the external anal sphincter. And these are the anal glands which are blind ending, which are usually vestigial, but if they get infected, they can lead to perianal abscess as well as fistula in ano. So that is the significance of these anal glands which open into the anal sinus or crypts, which are present in the pockets formed by anal valves. Anal papilla is formed where the margins of anal valves join the anal columns, and they present as small projections. Usually they are not of much significance, but sometimes they can hypertrophy and prolapse, and sometimes there can be fibrous polyps arising from anal papilla. So these are the different structures that help in formation of the dentate line. So now I hope this part of anal canal anatomy is also clear. So now to summarize, as we all know in the side figure, anal verge up to 2 centimeters above the anal verge is the dentate line, and that part forms the anatomical anal canal. Above the dentate line up to the puborectalis sling is another 2 centimeters, and this total 4 centimeter from anal verge to puborectalis sling forms the surgical anal canal. Different terminologies that we have used and defined and various landmarks. Just a brief summary: anal margin or the perianal skin, which is the 5 centimeter radius around the anal verge; intersphincteric groove or the white line of Hilton. And now I am sure you know that it can be interchangeably used with anal verge, inocutaneous line. All these terms essentially mean the same, and they are present in an extent of 3 to 4 mm and can be used synonymously. Above this region, around 2 centimeters above, is the dentate line or the pectinate line, and the part of the anal canal between anal verge, inocutaneous line, white line, intersphincteric groove, and the dentate line on the other end form the anatomical anal canal. Anal transition zone, as I have described, is a very important area for surgeons, especially because this is the point which forms the zone between uninterrupted columnar mucosa above and uninterrupted stratified squamous epithelium below, and it has extensive innervation, which is very important to preserve in doing pouch anal anastomosis. Puborectalis sling, levator ani, anorectal ring or anorectal junction is the uppermost landmark of anal canal, and the anal canal from anal verge below to puborectalis sling above is the surgical anal canal. Apart from this, we have also seen the formation of dentate line with the help of anal columns of Morgagni, anal cushions, anal valves which nest the anal crypts where the anal glands open. So this essentially covers all the different terms and landmarks that are used for describing the anal canal anatomy. In upcoming videos, we will see how anal canal goes above as rectum, how to remember anorectal region musculature, blood supply, lymphatics, as well as nerve supply. So stay tuned with us, subscribe to our channel, and keep suggesting topics like this. This was a very interesting topic, and I hope all of you enjoyed this discussion on anal canal anatomy. Thank you.